As a parent, there's nothing more heart-wrenching than watching your child struggle with chronic health issues, despite trying every recommended traditional medical approach and then going fully down the road of natural and holistic health remedies. You've been to countless doctors, specialists, filled numerous prescriptions, and explored various holistic and biomedical therapies, diet changes, detoxes, cleanses, vitamins, supplements, herbs, infrared saunas, and so forth. But nothing seems to work, and the frustration and helplessness can be overwhelming, leaving you questioning if there is something you're missing or is my child just stuck this way. But what if the real key to unlocking optimal potential and healing for your child is doing all the things but in a different order or sequence? What if it's as simple as breaking things down to a more specific sequence or batting order that aligns with the exact pathway of stress and dysfunction that caused them to get sick in the first place? This video is for exhausted parents who have tried both traditional medical approaches and natural health alternatives for their chronically struggling children, yet continue to see limited lasting results despite doing all the right things. So, you're going to discover why the sequence of healing matters more than the individual therapies themselves, and how addressing nervous system dysfunction first through neurologically-focused chiropractic care can finally unlock the results you've been searching for from everything else you've been already doing. Here's what's absolutely fascinating about the shift we've seen in healthcare over the past 15 years. In the early stages of practice, 80% of our patients were already medicated before learning about neurologically-focused chiropractic care, and 20% of them knew anything about gluten, dairy, vitamins, supplements, and drug-free approaches. Now today, that has completely flipped. 20% of our patients that take medications, and 80% of them have already gone down the roads of natural health and drug-free healing. But here's the concerning reality. Chronic disease prevalence has risen to nearly 30% in the last 20 years, and our average new patient today has more illnesses and various health struggles, which reveals a critical gap that most parents and even healthcare providers are missing entirely. So, 1. Understanding the neurological hierarchy of health development. The nervous system develops first in utero, acting as the air traffic controller for your child's body by coordinating vital systems like gut health, immune function, motor skills, and brain function. Dr. Bruce Lipton, a cellular biologist and a researcher, explains that the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells, which is why the neural tube is one of the very first things developed during pregnancy. And when the nervous system gets derailed and off track developmentally due to early life stressors, everything downstream gets thrown off as well. This is why nearly every child struggling with chronic neurodevelopment conditions also struggle with digestive problems, weakened immune responses, motor challenges, and sensory processing difficulties. 2. The three sequential steps of optimal neural development. So, step 1 is the nervous system is the foundation. Without proper nervous system regulation and function being activated and optimized first, everything else is limited in what we can do and the results you should expect. Step 2 is the motor system, because movement truly is life, and every childhood development expert knows that motor development is the key to a brain and nervous system development overall. But muscles can't move themselves. The nervous system must function properly first for motor coordination to develop properly. And step 3 is gut and immune health, which, while absolutely essential, is controlled first and foremost by the nervous system through the vagus nerve and brain-gut connection, which means the brain-gut connection comes before the gut-brain connection. 3. Why the batting order or sequence of healing matters most. Each individual form of natural, holistic, integrative care is amazing and does its job. But when we address the nervous system dysfunction first, we unlock something within your child's brain and body that makes every single other therapy work exponentially better. This is why so many parents report that their children finally start seeing massive gains in PT, OT, and speech therapy once they begin getting adjusted. because we addressed the foundational neurological dysfunction that was limiting all other therapies from achieving optimal results. So we're reopening neural sensory pathways that were once closed due to subluxation, but now open through neuro-focused care, allowing proper development to be achieved. Think of it like trying to restore and rebuild a home that sits on a crooked foundation. No general contractor would spend hundreds of thousands of dollars remodeling without first repairing and restoring that foundation until it's stable and solid. If you feel a child is at a stuck point and trying every single route of healing from the traditional medical route to the holistic alternatives, or maybe even has been hitting a plateau in the therapies and nothing seems to stick or work, it's time to start addressing first the foundation of how your body heals through the nervous system. To learn more about the nervous system and its continued role in our child's health and development and how neurologically focused care can help, click the link in our bio to learn more.